What makes a session feel safe? Many people assume safety in therapy means feeling comfortable. The therapist is warm. The room feels welcoming. The conversation flows easily. Nothing feels too confronting. Nothing feels too difficult. And while these things can certainly help, experienced therapists often discover something more interesting. Safety and comfort are not always the same thing. In fact, some of the most important moments in therapy occur when people are discussing things that are deeply uncomfortable. Fear, shame, loss, rejection, regret, vulnerability. The question is not whether difficult emotions appear. The question is whether those emotions can be explored without the person feeling overwhelmed, judged, or alone. This distinction changes how many therapists think about safety. Because therapy is not simply a place where people feel good. It is a place where people can safely engage with experiences that often do not feel good at all. Imagine meeting somebody for the first time. Within a few minutes, they begin asking questions about your relationships, your fears, your insecurities, your struggles. Most people would not immediately reveal their deepest thoughts to a stranger. Not because they are hiding something, not because they are unwilling, because trust takes time. Human beings are remarkably sensitive to safety. Long before people consciously decide whether they trust someone, they are often paying attention to subtle signals. How does this person respond? Do they seem interested? Do they seem judgmental? Do they rush to conclusions? Do they appear comfortable with emotion? Do they actually listen? Many of these evaluations happen automatically. The person may not even realize they are making them. Yet they can strongly influence what feels safe to share. This is one reason therapists often pay attention to the quality of the relationship itself. Many beginning therapists become highly focused on techniques. The right question, the right intervention, the right interpretation. These things can certainly be valuable. Yet experienced therapists often notice that techniques tend to work best when a strong therapeutic relationship already exists. The relationship creates the conditions that allow therapeutic conversations to occur. Without those conditions, even excellent interventions can struggle to land. Interestingly, safety is rarely built through a single moment. It usually develops through many small moments. A therapist remembers something important. A therapist remains curious rather than judgmental. A therapist listens carefully. A therapist allows emotion without immediately trying to fix it. A therapist acknowledges an experience that may have gone unseen for years. Individually, these moments can appear quite ordinary. Together, they gradually create trust, and trust often creates safety. This becomes particularly important when difficult emotions emerge. Imagine a client beginning to discuss something painful. Their voice changes. Their posture shifts. Their eyes look away. Emotion begins to surface. At this point, many possibilities exist. The person may continue exploring. They may change the subject. They may minimize the experience. They may intellectualize. They may joke. They may become silent. Each response can tell part of a story. Not simply about the problem being discussed, but about the person's relationship with emotional vulnerability itself. For some people, emotions have historically been met with criticism. For others, emotions have been ignored, dismissed, invalidated, punished, or overwhelmed. As a result, emotional expression may not automatically feel safe. This is one reason therapists often move more slowly than people expect. The goal is not to force disclosure. The goal is not to push people toward vulnerability before they are ready. The goal is to create conditions where vulnerability becomes possible. There is an important difference. People often open up when they feel they have a choice. They feel respected. They feel understood. They feel that their experience matters. Safety tends to grow when people feel they can move toward difficult experiences at a manageable pace, not because they are being pressured, but because they are being supported. This is also why therapists pay attention to their own reactions. Safety is not only influenced by what the client is experiencing, it is also influenced by what the therapist brings into the room. Can the therapist remain calm when strong emotions appear? Can they tolerate uncertainty? Can they stay curious when they do not fully understand something? Can they resist the urge to rush towards solutions? Clients often notice these things, sometimes consciously, sometimes unconsciously. A therapist who remains grounded can help create an environment where difficult experiences feel more manageable, not because the therapist removes the discomfort, because they help the client stay connected while the discomfort is present. This may be one of the most misunderstood aspects of safety. Safety does not mean nothing difficult happens. Safety means difficult things can happen without destroying the relationship. A client can feel anxious and remain connected. A client can feel ashamed and remain connected. A client can feel uncertain and remain connected. A client can feel emotional and remain connected. This experience can be surprisingly powerful, particularly for people whose earlier relationships taught them something different. People who learned that conflict leads to rejection, that vulnerability leads to criticism, that emotions lead to abandonment. Therapy can sometimes offer a different experience, not because the therapist is perfect, but because the therapist remains engaged when difficult experiences arise. Over time, this creates something important. The client begins to develop a new relationship with themselves. Experiences that once felt intolerable become more manageable. Emotions that once felt overwhelming become more understandable. Conversations that once felt impossible become more accessible. Not because the emotions disappeared, because the person no longer has to face them alone. Perhaps this is why safety sits beneath so many counseling skills. Questions, validation, listening, silence, reflection, empathy. Each can contribute to the same underlying process, helping another human being feel safe enough to explore their own experience. And perhaps that is the real purpose of psychological safety. Not comfort, not certainty, not protection from every difficult feeling, but the confidence that difficult experiences can be explored without losing connection. Because when people feel safe enough to remain present with what matters, meaningful change often becomes possible. And in our next video, we'll explore a closely related idea. Because once somebody feels safe enough to engage with difficult emotions, another question naturally emerges. What exactly do therapists mean when they say, "Stay with the feeling"? We'll explore that next.